Welcome, everyone, to the La Jolla Cosmetic Podcast. I'm your hostess, Monique Ramsey. So, a lot of patients like to stay somewhere. If they're traveling from out of town, they want to stay somewhere close by when they're having their surgery. And recently, our videographer, Gretchel, teamed up with Dr. Salazar to create kind of a quick clip introducing and highlighting 3 hotels nearby and kind of our top 3 picks for plastic surgery recovery. So Dr. Salazar, he's the world traveler, and I thought he'd be the perfect person to kind of introduce the idea of, when, who, why, how, and where we might want to go to a hotel nearby. Who needs to do that? And even sometimes people locally just don't want to be at home. It's a little chaotic sometimes with little kids and stuff. So we're going to dig into these 3 choices, and we're going to ask a few questions about what do you prefer and why of each of these hotels. So welcome back, Dr. Salazar.
Thanks, Monique. Thanks so much for having me here on your podcast. And I think, yes, I think it is important for us to talk about. This is part of recovery, and your nest during recovery is essential.
Okay, so let me ask you the first question. Do we require an out-of-town patient to stay at a hotel for a certain amount of time before they can go back home?
Absolutely. So we do see, as you know, patients that come and visit from all over the country and also from other countries, and they fly in, and of course, safety comes first. So they go through a very meticulous examination, consideration of all the medical problems. Medicine has evolved, and we always have that first contact through Zoom if they're from out of town. And then gives us a good opportunity for them to know our philosophy, for us to understand their goals and to get the conversation going. But nothing is finalized until we examine them very thoroughly. As they are planning their time over here, we always, and depending on what surgery we're really talking about, we recommend a certain amount of time. So if it's something that it's very, very minimal, can be done in 1 or 2 days here of their stay, but that has to be a very minimal procedure. Then the more extensive procedures, sometimes we ask them to stay for a week, or sometimes we ask them to stay for 2 weeks. And then what we do, and again, with the facilitator of Zoom, we can always continue following them up as we usually do if they were to live here. So we can say, you can stay here for a week, go back, then come back virtually at 3 weeks. And then at some point, anywhere from 6 to 8 weeks, maybe come back in person and we can get some standardized pictures and so on and so forth. But yeah, depending on what we're going to do, is that we are going to ask them for a certain amount of time of being here in San Diego.
Okay. And which procedures make it especially important to stay nearby instead of maybe heading straight home?
So especially, number one, the first answer is procedures that require a little bit more of a recovery, right? A little bit more of a true surgical recovery, such as, for instance, if you're talking about like a tummy tuck or a procedure that is going to decrease your mobility, we definitely want the patients to be around. Other things that are going to influence as well is, that even though patients hate drains and doctors hate drains and nurses hate drains, if the procedure involves having some drains, then we need to have those patients stay until we can remove those drains.
And that kind of depends on how much fluid output there is, right? Like maybe there's a rule of thumb that it's 7 days or 14 days or 12 days, but also could be a little bit dependent on the patient.
Correct. So we can give them a good estimate of when those drains are going to be coming out, and because depending on what procedure, it's either a breast reduction. Sometimes we use drains. If it's like a breast revision case, even a facelift, they have drains, but they come out like sooner. But depending on which case, at a tummy tuck, then you can give the patient an estimate. But then there's always that plus minus. So if we think that it's a week, sometimes it's 7 to 10 days, or it may be 5 days. But we tell them, for instance, plan for 7 to 10 days after an abdominoplasty, staying here so we can remove those drains. Another factor is if that procedure calls for sutures that need to be removed, stitches that need to be removed. Sometimes we think as civilians or as patients that removing a suture or removing a drain I mean, it sounds like a mystery, but sounds at the same time something that should be very simple. And
Mhm.
maybe if I'm not from San Diego, if I'm not from this area, I can go back to San Francisco, I can go back to Alaska, I can go back to Hawaii, and then find someone that will remove those sutures or that would remove those drains for me. That's a very common thought, but it's really hard for a patient once they go back home to find someone who is willing to take those sutures out. And for that reason, it's important that either they stay here during that time or they go back home and then come back for to get those sutures removed.
Mhm. Yeah, like if
Hmm.
you lived in LA, you could come back a week or 2 whenever it's time for those sutures to come out, but you
Hmm.
weren't having to stay down the whole time. So the first hotel I wanna talk about is sort of a La Jolla icon. It's also known as the Pink Lady, and that Pink Lady is the La Valencia Hotel. It's right on Prospect Street, has a gorgeous view of the ocean, and I'm gonna tell you, if anybody you're not having your espresso martini while you're having surgery. But if you want a really good espresso martini, that's where you go. So the La Valencia Hotel is the first one up on our list, and it's been around almost 100 years. And it's a beautiful place. Let me ask you, Dr. Salazar, is that one of the hotels that you like to send patients to?
It's definitely an icon, right? I mean, I remember having brunch with my grandmother many years ago, and it's truly a reference point of La Jolla. It is a true icon. I think it's a great option as a hotel if you're planning to stay for some time after surgery. It's going to give you. It's close enough to the office. It's the further away from the office than the other two options, but it's still close enough that you can stay there. I would say, it's going to put you right in the epicenter of La Jolla Village. So
Mhm.
not only are you going to have a great view, but also you can go out for an easy stroll, window shopping kind of activity after surgery. But in reality, I'd recommend that hotel if you're not having a procedure done that involves anything that we do that decreases your mobility. It has a couple of stairs, a set of stairs. It is more a hotel that patients that would have a surgery, a smaller intervention would be able to enjoy better.
And I think it's a great location for, maybe, let's say you're an out of town patient and you come back for a 3-month post-op or a 6-month follow-up. Have a long weekend there, because
Exactly.
it really, where you can enjoy being right downtown in the village and the espresso martini. So
Absolutely. And
okay, so then the next, and one of my questions I was going to ask has to do with pricing, but as I was doing research about pricing, it's all over the board because it depends on the
mhm,
time of year, it depends on the type of suite, whether you're talking, I have little pop-ups coming, from
who you're buying
130
it from. Mhm.
$139, and another one was 600, and so who knows. But so I'll let all of you do your own price shopping research. But our next one on our list is the Lodge at Torrey Pines. Same question, sort of, what makes you love this hotel for patients nearby besides the cute guys at the front? This is why I love this hotel. The cute guys at the front in their Scottish kilts. So, but
Totally.
for our patients, it's a lovely place. Again, ocean view on a golf course. It's just spectacular.
It's spectacular. It's really a unique property, I would say. It's iconic as well. It's so beautiful, so spectacular. So that property is the second closest to our facilities, and they accommodate so well for patients. They have this dedicated recovery rooms, so you don't have to check through the front desk. Because imagine if after surgery you do not want to be registering or anything, and they can facilitate that process if you didn't do it the day before, or if you are having surgery and then want to check in. And I know I understand that this would apply more for like even local patients that they want to have surgery, so they would sleep at their house, and then the next day they come in, they get surgery, and then they go to the hotel. But definitely is a much more quiet environment. The rooms that they can adapt for the recovery of patients, they go from their basic room up to a very large corner, beautiful suite with a great golf course and ocean view. So if you want to just like open your windows and then get that nice ocean breeze and then just listen to some of the golfers and watch them hit some balls, because that's important. Watch them hit some balls.
Yeah,
I have
don't hit the balls.
literally yesterday, we had a patient that we are going to perform surgery on next week. And patient was asking, like, maybe he was going to stay at the lodge and he wanted to hit some balls on day 2 or 3 after surgery. And I
Really?
said, no, you can't. You can appreciate the technique of other golfers from the comfort of your room, but definitely do not go out and hit some balls. So their food is amazing.
Yeah.
The level of service is spectacular. It's one of my favorite spots in the entire area of San Diego. Highly recommended. They accommodate for patients. It's nearby, and even it's a place where we could easily, that our patients can opt in for having the surgeon going to do the first post-op check, the day 1 after surgery check. Instead of them having to come into our office, we could go there, and it's a great facility where we can go and take care of that.
And it's more private, right?
It gives you a much more private feeling.
Yeah, that's really nice. And I can attest the food is spectacular there. I love it. I love going there. They have good hamburgers.
They have
Okay,
good
so
food.
our last one on the list, and is certainly not least, is the Estancia La Jolla Hotel and Spa. And what makes this one stand out and how close is it?
So this one here is the closest one. It also gives you that flavor of privacy. I wouldn't say that it has those spectacular views that we were talking about, but the administration recently changed, and the entire property underwent some serious $1 million renovation, and it gives you a flavor of an exclusive place where you can go and have a retreat. So the atmosphere is pretty quiet. They also have great options for you to eat there or order to your room, and also the level of the attention to detail of the people that work there is simply spectacular. So that's another place where our patients can also recover. We can easily go and visit them for that first post-up visit if they opt in for that, or it's an easy 5-minute drive
Yeah.
on an Uber or with a family member to our facility.
Now, what are some of the low impact activities or sightseeing options around these hotels that you might suggest for patients while they're taking it easy? Because even walking sometimes can, that increases your heart rate and, things can get busy inside your body while it's trying to heal. And so, what do you really recommend for people?
In reality, I mean, as you know, we don't want our patients. I mean, maybe sometimes their body ask our patients after surgery to stay in bed, right? Because that's what sometimes your body will ask you, and we don't want that. We want them to mobilize. We want them to not stay in bed at all times, just to sit up, go to the couch on those first couple of days, move, walk around, and especially inside, not too much outside. After that, little by little, they can be becoming more and more active. Still, the biggest risk and the reason why we ask our patients not to perform exercise is basically for them not to get their heart rate up. Heart rate goes up, blood pressure goes up, and then they can potentially bleed. And that's the main reason why we want them to take it easy. So when they ask me, can I go for a walk? Can I go outside and go for a walk? And the answer is yes. Wear your sunscreen. Don't get exposed to a lot of sunlight. But yes, stroll is the right word, not hiking, not power walking, not
Not
walking up a hill,
right. Elevations. Yeah.
elevations, not going down to the cove, right, and start exploring the caves and rocks. And no, please. The same, I mean, sometimes say oh, I have a dog, can I walk my dog? It was well, if it's a Chihuahua, maybe, but if it's something medium or large size. Why? Because we don't want that physical effort. So things that you can do. I mean, we have here, for instance, I even talk to people to give them an example. It's if you have a nice stroll, even at the mall, UTC is here. It's a fantastic mall. Probably you're not going to be in the mood for doing extensive shopping or anything like that. But if you just do a nice window shopping stroll in UTC, that would be fantastic. If you go to La Jolla Village and then do the same. They have like very interesting shops that you can just go in, walk in, check it out. Again, walking, not like the store is about to close and you got to go and return something. So that's not the kind of walk that we're talking about, but it's just literally like nice window shopping walk.
Now, thinking about people traveling, how far in advance should patients be thinking to book their surgery to get maybe the date close to the date they want, and then how long ahead that they're trying to book their hotel? Because sometimes you think, oh yeah, I'll be able to get a room, and then there's some convention or something or a golf tournament. So what do you recommend there?
So I would say, especially, I mean, to plan it all together. In reality, that things and during the year we have like many peaks of high season of surgeries, and that's when mainly people want to have their surgery, like in a specific date. Like for instance, December is coming. I mean, people would sometimes would think like, oh, with all the holidays and everything, maybe not many people are going to be considering surgery. No, it's like everybody wants to get surgery in December, and for patients to, if they want to secure a date, that you can have a consultation 2-3 months ahead of time. We can plan it all. They can most likely 3 months ahead of time. They can even select almost practically the day, the time. They can get priority on all those things, and then starting around that time to still book their flight, book their coordinators. The patient's coordinators will tell them exactly when, how many days before, and then how many days after we are expecting them to be here. Then, as soon as they know that, for them to book that room, they're going to get a much, much better rate. And then once, I mean, we understand that if they're coming from out of town, we will be facilitating different things for them, such as some of the post-op visits, doing them online, doing them on the Zoom. And then, as you were saying, maybe at 6-8 weeks, they're coming back and they stay for like the full weekend, not only
Yeah.
the day of their post-op check. But yeah, I would say like when about 2-3 months ahead of time to plan for that.
And I want to bring up, just from my own personal experience, something that local patients might not think of.
Hmm.
So I live very close to La Jolla Cosmetic Surgery Center, very easy to get back and forth. And after I had my facelift, I was like, I can go home, right? So, and I did go home. However, the kids, were 7 and 9 or something years old. My stepmom came over and she was handling dinner, and everything's great except for me, the patient, right in the room next door. The noise, the stress of like hearing the kids and thinking like, what's going on, and the smell of the food. She's an amazing cook, but
Hmm.
I was nauseous. So smelling the food, but you're thinking, so sometimes even if you are living nearby, having a night or two away might ease the stress. You don't have those outside things like thinking, is everything okay? Do I need to, what do I need to do for them, that you're away and you've got either your husband or your wife or your best friend or your mom who's going to be with you, and then you're not having to stress out about what's happening at home. And I think that my pearl of wisdom that I would give to our local patients is just think about that. And it's one thing if you go home and maybe the kids are at grandma's house, right? Then you're
Hmm.
fine, you're in your own
Hmm.
element. But if it's all everybody at home while you're there, I'm just that's my pearl for the local
No,
patients.
we hear it. We definitely hear it all the time. So I would say consider it, if you, because nothing is going to give you more peace of mind that if everything's well taken care of at home, and then you're just recovering there for the first couple of days. Even one night will make a big difference in your recovery, just for you to be in the of healing.
And one other thing is when you're at a hotel or even at home, but at a hotel, and maybe you don't have a spouse or significant other, or your
Correct.
mom lives in, Florida, and you're here. there are nurses that we have lists of who can stay with you, who can take care of you, either at your home or at a hotel, right?
That's correct.
Okay, I have one last question, and it's maybe sounds like a silly question, but
Oh,
maybe
no.
it's a real concern. What's the
Throw
best
it.
what's the best way for patients to get extra pillows? Do they bring their own pillows? Because I think sometimes, you want certain elevations, or, will these hotels have what you need?
Right? I mean, they'll totally accommodate for you. And you know that it's like, I mean, definitely you at home, you have a limited number of pillows, but the hotel has limitless pillows and limitless sheets. And sometimes, I mean, let's look at it from I mean, you were saying, I mean, we're talking about trivial things, right? So let me
Right.
put it in a trivial way. Let me tell you, sometimes what we do, and when we do either liposuction or like some type of breast reduction, or there can be a little bit of oozing after surgery.
Mm.
And what we recommend is, of course, like put like, I mean, on your bed, put a towel underneath, and then you have the patient lay down, then you put another towel, and then you get your sheets. And that way you can protect your sheets and you can protect pretty much all your linens, all your whites from like getting
Little
getting the blood
tinge.
or any like little bloody tinged. So sometimes it happens,
Yeah,
right?
yeah.
So sometimes it will happen. So if you go to a hotel, you don't have to carry or wonder how to remove those stains.
Yeah,
You don't have to.
they've got all the
You
secrets.
they got all the secrets. You'll see the next time you go, the room is perfect, and they have like again unlimited number of towels, unlimited number of pillows and sheets. So that's a very good advantage of doing that.
Okay, perfect. Well, thank you, Dr. Salazar. I mean, we really covered a lot today. And I think it's important for patients to know whether they're coming from out of town and they're going to start their journey on a Zoom consult with you and maybe end their journey on a Zoom follow up in 6 months or 3 months, or if they're local and you're wanting to stay somewhere nearby, that we've gone through these three amazing hotels. We will put links in our show notes of each of the hotels we talked about. You can go online and check them out, and they're all really wonderful. We don't want to recommend something where we wouldn't feel that you would be happy and comfortable. And I love your point about the linens and things like that. That's true. They have limitless linens and towels and sheets and pillows. So that's kind of a nice thing.
And they magically get cleaned.
Yeah, yeah.
Mhm.
And so if you're thinking about, coming to us and you're interested in information on traveling and information on a consultation, how to set that up, whether virtually or in person, and information about pricing. We've always been very transparent with our pricing for, I don't know, 30 something years. We've been putting our price ranges on the web. And so we have information about that. We also have information about financing, because I think if you are coming from out of town and you're having a bigger procedure and you've got part of your expense is going to be the hotel. And so maybe you might want to finance part of your procedure because the money you've saved might be going towards hotel. And so, our coordinators, like Dr. Salazar said, they're really good at helping you kind of manage this whole experience, and you having the experience that you want to have in the way you want to have it. And we're going to help build that custom experience for you. So we'll have everything in the show notes, all the links. And if you have any questions, shoot us a text, shoot us a phone call, email, whatever. We're here.
Perfect. This has been a great podcast, and I think it's a little bit different. We didn't go into very deep into medicine or any procedure or any surgery, but I like it. I like it because this is part of our patient care.
Yes, yes. So thank you again, Dr. Salazar, for your expertise and helping us in he came in his travel togs. So if you're watching on YouTube, he's got his little travel vest on and looks so cute. So, and so we'll see you all on the next one. Thanks for listening.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.